Hello, I'm Mabel Jong, and you're watching the World Healthcare Congress Interview Zone. I'm so pleased to have Steve Barner with me. He's the CEO of Cancer Treatment Centers of America. Steve, it's great to see you again.
Thank you, Mabel. It's great to see you.
And now you have 5 centers in America right now, and you hope perhaps to add another one in the future.
We may add another one, and our main philosophy is to understand the patient and try to make sure that we have what the patient wants as conveniently located as possible to them.
Now describe to me why it might be different for a patient to be treated at one of your centers versus at a hospital that also treats cancer or at another cancer treatment center.
We specialize in complex later stage cancers, and as a result we think that we can deliver on the promise to every cancer patient that if they come to CTCA they'll find the most comprehensive and up-to-date array of traditional therapies they can find anywhere. So we think we can show them the best radiation therapy, surgical capabilities, chemotherapy, but then we also recognize that those therapies treat the tumor, which you need to do, but cancer is not a tumor disease, it's a disease of the cellular underpinnings that we all walk around with. And so we need a very comprehensive and integrated and holistic array of therapies to surround those traditional therapies. And we think we offer the most comprehensive array of therapies. So nutrition, naturopathic intervention, the psychology of cancer, pain management, everything to yoga, Reiki, massage, chiropractic, humor therapy, pet therapy, anything that can lighten the load psychologically and emotionally is going to help us deliver a better therapeutic response.
Now you've recently conducted a very large-scale survey. What were some of the findings from that survey?
We just conducted a survey of 2,000 participants, 1,000 cancer patients and 1,000 of their caregivers, which we think is the largest survey of the national cancer audience that anybody's ever done. And what we found is that for all of our good intentions, and this covered all providers, not just CTCA, but providers of the national sample, is that the consumer is getting much smarter about oncology, and they're becoming much more adept at looking for information and getting information that they value. So they're a very active and engaged consumer with a much wider reach of information than we might have appreciated before. Number two, their expectations as a result exceed what we as an industry are able to deliver. And 25% of these participants say that what they expected and what they wanted they were not able to get where they were looking for their cancer care. 20% of these people as a result have changed providers. They've actually moved out of network or moved to somewhere else in order to try to find what they want. So again, this is a very active group of consumers. Next, they want somebody on their team that they can look to that's going to give them a personal relationship and continuity of care wherever they go. We can't expect to give them a different contact point every time they come in for care and believe that they're going to be satisfied. This is obviously an enduring disease and it's very different for them, and so they want a quarterback. They really want somebody at the organization that will be their personal quarterback to guide them through their disease.
That's a lot of information you were able to garner from this. What do you plan to do with the findings?
Change and get better.
Do you have a priority list of what you'll do first?
Yes, I mean we work on all of those things and we'll work to get better. In our model, we do provide now that quarterback. We actually provide a dual quarterback, so every patient who comes to us the day that they walk in get a relationship with a medical oncologist and with a nurse care manager who quarterback their team as long as they're in the relationship with Cancer Treatment Centers of America. So if they're home and they have a need, they have their phone numbers, they call them, and those people know exactly who they're dealing with. They also have a core team around those two, so they have a nutritionist that's with them throughout their care, a naturopathic physician, somebody that works on psychology, a trained psychotherapist, and a pain manager. And all those people provide continuity of care and the comfort that when there's an issue, they know where they can go for that care. We also are working to provide much better line of sight to information for each patient. They want to know what's going on, they have a right to know, and we've now created an iPhone app called My CTCA that creates a patient portal that's secure, that allows them to log on and have access to their complete medical record and to be able to share that with anyone else that they think would be helpful, whether it might be a family member or possibly another professional at home.
Right. Well, certainly there's a lot to learn about this journey, and I'm sorry we're going to have to leave it there, Steve, but I hope you'll come back.
Absolutely, anytime.
Thank you so much.
Thank you, great to see you.
And I'm Mabel Jong. Thanks for watching.